Good afternoon, and thank you for joining us on today's briefing. It is Tuesday, July 6th, and on today's briefing, we'll hear from Mayor Tom Barrett, Milwaukee County Executive David Crowley, and Dr. Ben Weston, Associate Professor with the Medical College of Wisconsin and Director of Medical Services with the Milwaukee County Office of Emergency Management. Thank you all for being here, and Mayor Barrett, I'll hand it over to you to get us started.
Well, thank you very much, Catherine, and good afternoon, everyone. It's actually good to be here with the county executive in particular, indoors, because we were outside together this morning at Pulaski Park with the United States Administrator of the Environmental Protection Agency. It was very hot, but I'm sure David shares my happiness of being inside, where we can talk about the progress that we are making. And of course, the place where we must begin, and I am very ecstatic about this, is the fact that our Milwaukee Bucks have emerged this weekend as the Eastern Conference champions, ready to take on the finals against the Phoenix Suns. So we've been talking to the Bucks because they've been such a fabulous partner with us on this to get people vaccinated. So we're talking with them about the possibility of doing another ticket giveaway for individuals who choose to get vaccinated by the Milwaukee Health Department at the Pfizer Forum Plaza in advance of the game. So again, we're working on this, but the possibility does exist that we'll be able to work something out. So an individual, and this is for many of us, a once in a lifetime experience to see the Bucks in the NBA finals. We hope it's not a once in a lifetime experience. We hope it's a once in 2020 opportunity, but we're very grateful for our partnership with the Bucks to vaccinate the community. And I'm hopeful that we'll be able to make someone's dreams come true by allowing them the chance to watch a live NBA finals game inside the Forum. So we're working on it. Stay tuned. But speaking of our great sports teams, of course, the Red Hot Brewers, until they got into this series with the Mets, where they had won 11 straight before the Mets, but they'll be back. This is a reminder that those who receive the Pfizer vaccine at our pop-up clinic in partnership with the Brewers on June 15th or 16th, at American Family Field should stop by again tomorrow, July 7th, from 3 to 7 p.m. to receive their second dose at Health Air Field. So again, those are for individuals who received their first shot June 15th or 16th at American Family Field. This is your time tomorrow to go get your second shot. I'd now like to turn to what we're doing in the city. We continue to monitor disease burden in the community and track our vaccination rates across the city. So this week, I'm pleased to share that we remain in the moderate transmission category for COVID-19 cases per 100,000 people, down to 12 cases per 100,000. We'd like to drop out of the moderate into the low, but we're making progress in that area again after we had a slight uptick. Our percent positivity rate remains in the low transmission category at 1.3%, and our vaccinations continue to creep up. They continue to increase, with our percent of adults fully vaccinated at nearly 50%. To be more specific, our vaccination rates are 48.6% of City of Milwaukee adults, that's individuals 16 or older, who are fully vaccinated, and 53.1% of adults have received at least one dose. So we know we have more work to do, but we're going to continue to work as hard as we can to have these numbers improve. Remember, disease is still present in our community. A higher risk exists for those who are unvaccinated, and it is appropriate for those individuals to take greater precautions, such as wearing a mask indoors and around others to keep themselves and their families safe. Finally, I'd like to share that the U.S. Department of Health and Human Services of Minority Health has granted the City of Milwaukee's Office of African American Affairs $4 million in the fight against COVID-19. In Milwaukee, as we all know, the COVID-19 pandemic exposed significant racial inequities, with the disease disproportionately affecting our communities of color. It is a crisis that requires prompt and thorough action, and this grant is a good step forward in that work. The award is part of the Office of Minority Health's $250 million two-year initiative to identify and implement best practices for improving health literacy, to enhance COVID-19 vaccination and other mitigation practices among underserved populations. Health literacy is defined as a person's ability to find, understand, and use information and services to help them make health-related decisions for themselves and others. So over the next 2 years, the Office of African American Affairs will work with community-based organizations to develop a health literacy plan to increase the availability, the acceptability, and the use of COVID-19 public health information and services by racial and ethnic minority populations. The city's Office of African American Affairs was created to promote equal opportunities for African American residents in areas of employment, education, job training, housing, healthcare, voting rights, and business ownership. And obviously, this grant is going to help us move toward those goals. So there's a lot of work that needs to be done, but there's a lot of work that has already begun as well. And with that, I'm pleased to turn it over to County Executive David Crowley. Mr. County Executive.
Well, thank you so much, Mayor Barrett. And you look good sitting in the air conditioned. And I think we're all excited about what has happened over this past weekend and really excited to see game one of the finals with the Bucks making it. Good afternoon, everyone. And as you know, as thinking about it, as we come off the holiday weekend, I hope everyone had a nice 4th of July. And with that, I want to make sure I give a special shout out to our Milwaukee County Park staff who has worked tirelessly throughout this weekend in extreme heat, really to keep our parks clean so everyone could enjoy them. And this year, the 4th of July carried even more significance as President Biden's goal was to have 70% of American adults receive one vaccine shot by this time. And nationally and locally, we feel short of meeting this goal. But in many ways, it might seem like we're returning to normal and resuming all of our regular activities and holiday celebrations. But the facts and the data shows that the pandemic is not over. And so right here in Milwaukee County, we're nearing 50% of our residents receiving at least one dose of the vaccine. And this means we still have a ways to go in getting our community and loved ones vaccinated. And with the contagiousness of the Delta variant, we know that the vaccine is the most effective way in mitigating the spread of the virus. And as we resume more day-to-day activities, we must remain vigilant. So this means we have to wash our hands often, wear a mask when necessary, and get vaccinated or encourage your loved ones to do so. The next thing is I would like to applaud Governor Evers for signing Assembly Bill 374 into law, which allows for the maximum amount of opioid settlement funds to be paid to Wisconsin counties for opioid mitigation and reduction. And this bill can be the key to unlocking desperately needed funding for local communities all across the state of Wisconsin in order to address the destruction that has been left by the opioid epidemic. And so Milwaukee County, we have been on the front lines of this battle, pursuing relief through the courts for years. And now we believe that a settlement is imminent after years of work to hold the responsible parties accountable for the damage that they have caused through opioid addiction. And so we have a duty really to respond to a growing demand for prevention and treatment services, but the strain the crisis has had on local budgets and staff morale during this difficult time cannot be underestimated. And so the opioid epidemic has really left a wave of destruction in communities all across the state. And now we have a chance to get the funding that is needed to help those affected by this crisis. So this legislation will help our efforts locally by expediting the flow of dollars to communities like ours and really help fund critical services that will help save lives and mitigate continued suffering for residents and their loved ones. But also over the past year, in the midst of this pandemic, our EMS calls for overdoses have continued to increase. And we've seen an alarming increase in overdose deaths by nearly 30%. And these are alarming numbers. And so projects are showing that this year will exceed that record amounts of fatal overdoses seen in 2019 as well as 2020. So, but I will say that we are hopeful that through legislation such as the opioid settlement bill and providing community resource services and education, we will begin to see a steady decrease in overdose deaths, opioid misuse, suicide attempts, and general mental health issues throughout Milwaukee County. So if you or a loved one is struggling, please seek help. Milwaukee County offers various types of resources, regardless of your ability to pay. And so if you're looking for assistance or know anyone looking for assistance, please call the Milwaukee County Behavioral Health Division crisis line. That number is 414-257-7222. I'll repeat that again. The Behavioral Health Division crisis line number is 414-257-7222. And with that, I'd like to hand it over to Dr. Weston. Dr. Weston.
All right, thank you, Mr. County Executive. Good afternoon. First to our numbers, we're currently seeing in Milwaukee County an average of 14 new cases a day and about one death every 2 days. Now, as I've been talking to my patients as well as members of the public who've not been vaccinated, I often hear them cite stories that they've heard about side effects from the vaccines. And this has certainly been compounded by certain news personalities and political figures discussing reported isolated cases of perceived side effects. Now, to be clear, there are common side effects from the vaccines. People typically fall into one of three groups. So one group has no side effects at all from the vaccine. A second group has, much like I did when I received the vaccine, a bit of a sore arm for about a day or so. And then there's a third group, it's less common, but still with some regularity, that has flu-like symptoms. Lasts about 24 hours after receiving the vaccine as your body's building up that immunity, and then it goes away. Now, these symptoms tend to be fairly mild, and they go away quickly. So while these side effects that are documented and well-studied, these are not the side effects that we hear about often on social media and in other evidence-poor areas of our society. And in these corners, we hear about things like Bell's palsy, about Guillain-Barré syndrome, about weakness, chronic illness, these other terrible sounding side effects from the vaccine. But make no mistake, the vaccine has been given to over 180 million Americans. And when any medication or vaccine is given to that many people, we get a very good idea of what effects it truly causes. And what we found is that the vaccine is not associated to any significant degree with any of those discussed side effects. When you have this group of 180 million people, some by chance will have various medical issues that arise regardless of receiving the vaccine. As an extreme but illustrative example, you may receive the vaccine and the next day you're unlikely enough to go outside and be struck by lightning. Now, given that 180 million people have received the vaccine, chances are, just statistically, there's probably someone who indeed was struck by lightning shortly after receiving the vaccine. Now, did being struck by lightning happen after receiving the vaccine? Certainly. Did the vaccine cause them to be struck by lightning? Of course not. Now, the CDC carefully and painstakingly investigates reports of illness or any reports of death in those that have received the vaccine. And very few of these medical issues have been found to actually be related to the vaccine, but there have been some. So these include anaphylaxis or serious allergic reaction. This is in about 2 to 5 people per million that receive the vaccine. Real side effects also include a certain type of rare blood clot. We've discussed this before, in about 3 people per million, specific to the Johnson & Johnson vaccine only. And now the mRNA vaccines may be related to an extremely rare heart inflammation. It's typically mild, it's short in duration, and it's quick to resolve in young people. That's still being investigated, but again, it's very rare. Now, we have seen events where several people from around the country are gathered together to discuss side effects that they attribute to the vaccine. And these events certainly cause hesitation among many who've not yet received the vaccine. We as humans are naturally more affected, more influenced by individual personal stories than we are by larger scale statistics, even though those may be much more accurate. And undoubtedly, these individuals are going through tough times, and I feel for their situation. However, we must look at the broader picture of COVID vaccination. As an analogy, we can consider seatbelt usage. I'm sure that we could search the country and find individuals who believe that they received an injury from wearing a seatbelt. Perhaps they say it trapped them in the vehicle. Perhaps it caused skin irritation, or in the setting of an accident, they blame it for some sort of nerve damage that they got. However, at the same time, we can certainly find hundreds of thousands of people whose lives were saved by seatbelts. Now, the rare stories of a few people who believe the seatbelt caused them harm does not outweigh the many that they protect. And just as you still wear your seatbelt in the setting of these rare stories, so should you seek out vaccination in the setting of those rare stories, even though they may gain more attention. Now, the vaccines have led to low burden of disease that we're seeing in our community today. But COVID is not over, and particularly it is not over for those of you who are unvaccinated. And this is particularly the case with the ever-expanding Delta variant, causing increased cases and increased hospitalizations and deaths in many communities throughout the world. So I ask you to fight through the noise, overcome the gossip, seek out the facts, follow the evidence, and listen to the experts. And if you've not already done so, go out, get your vaccine. It's safe, it's effective, it's absolutely free. You can go to healthymke.com to find a vaccination site near you. Thank you, stay safe, and I'll hand it back to Catherine.
Thank you, Dr. Weston. We'll now transition over to the media Q&A portion of our briefing. And our first few questions are for Mayor Barrett, and they come from Allison Durr with the Milwaukee Journal-Sentinel. I'll ask them one at a time, and they're in reference to the Office of American Affairs $4 million grant. Her first question is, what will this grant allow the Office of American Affairs to accomplish that efforts from the Health Department and others have not?
Well, that's a very good question. And I view this grant as a supplement to the great work that is already occurring in the community that's being led by our health department. At the same time, we all recognize that the vaccination rates for people of color are not where we want them to be. We want these numbers to be higher. And I think the federal government recognizes this. So I have right before me the document here that talks about this project. And it's a funder that comes out of the Department of Health and Human Services, Office of the Assistant Secretary for Health, Office of Minority Health. So it's geared towards people of color. And so to have it go to our Office of African American Affairs, it makes sense. Now, again, I view this as a complement to the work that the health department is doing, but it's going to allow us to have, I think, even deeper penetration into those neighborhoods, into the communities that we have not been able to reach. And that's my hope. That's my hope and my expectation. And it's really about connecting with people, having credible messengers, getting the vaccines there. So that's my answer to the first question. Maybe I'll read the second question here, Catherine. With the pandemic easing, at least for now, is there any risk that releasing a health literacy plan related to COVID-19 2 years from now will be too late? Again, it's not as though we're stopping work. To the contrary, this is putting our foot on the accelerator and doing several things at once. But to me, without doubt, the biggest priority right now is to continue to get shots into people's arms. So looking at a report several years down the road, again, is not, in my mind, contrary to what we're trying to do. What we're trying to do is get people out on the streets right now, get people to trust what's being told them, and that means that they have to understand it. That's what we're going to do. Then the final question, which I've answered in part, is why is this funding going to the Office of African American Affairs and not the Health Department, where it seems previous funding is going? I think you can tell from the source of the funding that it is geared toward communities of color. It made the decision that it wanted it to go to this office. I'm fine with that because this office will work very, very closely with the health department to get the vaccines into people's arms.
Thanks for covering off on those questions, Mayor. Allison has a follow-up question, at this point, it's the final question I'm seeing in the chat, and it's for the mayor and the county executive. She says, regarding an opioid settlement, is there any sense for how soon that settlement could be coming and how much Milwaukee and Milwaukee County could receive?
So at this moment, we don't know when the settlement dollars will be coming, but we have a feeling it will be coming relatively soon. But as far as to how many, what funds we'll receive at the county and the city, I'm not sure what that dollar will look like. But based off of the legislation, 70% will be going to the counties and 30% will be going to the state.
And we will be working with the county, obviously.
Absolutely, working together on this.
Thank you both. I'll give it just one more minute to see if we have any additional questions. Those are all that I'm seeing in the chat at this time. Just give it 1 minute.
Yes, on the opioid settlement, the city and county both sued separately. That is correct.
And Allison's just wondering, so would funding come straight to either entity as opposed to the state?
It is my understanding that the dollars will come directly to the counties and working in conjunction with many of the municipalities. It's all about partnerships when you think about how we're going to tackle this opioid crisis. And I believe the state with their 30% along with joint finance could settle on where the rest of those dollars go. But I would say you may want to talk to the state of Wisconsin about that.
I'll jump in on the next one, and maybe David and Dr. Weston want to jump in. Of course, I have a concern about COVID spikes following Bucks watch parties and celebrations. And I'm worried about those people who have made the decision not to get the vaccination. For people who have gotten the vaccine, I'm not worried, but for people who have not gotten the vaccination, I'm very worried.
Ditto.
Yeah, same thoughts. I think, anytime anybody gathers, we worry a lot less now about people who are vaccinated who gather, but for the thousands of people who are gathering for these games, certainly a large portion of them are unvaccinated, and certainly a large portion of those who are unvaccinated are also unmasked.
Those are the questions I'm seeing in the chat. So perhaps people are already preparing for the game. Thank you all for attending. Thank you, media, for the questions. And we'll be back here on Thursday, but go Bucks.
Go Bucks. Bucks in 6.
Bye.